am Dr. Ravi Sauhta. I am Chief Orthopedic Surgeon and Head of the Department and Director at Max Hospital, Gurgaon. I take care of pelvovestibular surgery, knee and hip replacement. I have fellowships from USA in revision knee joint replacements, revision surgeries, spine surgeries from Korea, and I have about 30 years of experience in the field of orthopedics. So today we will be talking about young arthritic knee, how to preserve the joint and prevent joint replacement. Basically, these days what we are finding is that younger and younger population between the age of 45 to 64 are getting about 50% of these patients are having arthritis. And this is very, very common, especially in the belt, which we see Rewari and other areas, where we see that these patients come young, they have symptoms of arthritis. After we rule out various causes which are specific to different known arthritic conditions like rheumatoid or any other disease which is related to the joint or a traumatic arthritis, then we know that these are having a degeneration, but that is set in very, very early. So what we do in these joints is to identify and qualify and classify them with the various investigations. We do the X-ray, we do the MRI scan, and at times we require to do blood investigations to rule out various causes. Once we have ruled out and specifically identified the degenerative arthritis in the younger age group, what we are doing is we are giving them certain nutraceuticals, preservations, exercise. So it is a multimodal approach where exercise, physiotherapy, knowledge of the patient is awareness is made to identify why they are suffering from different kind of problems. And then what we do is that sometimes there are PRPs which are used, which is platelet-rich plasma. Your own blood is used for, it is centrifuged, passed through a machine, and then it is injected into the joint. And after injection into the joint, it has been seen that joint recovery occurs, and there are also synthetic fluids which are available. So if the arthritis is in younger patients and it is in lower grades, grade 1 and 2, then in that case we can actually delay the process of arthritis by giving these conservative treatments, physiotherapy and exercise, beside adding these various nutraceuticals to these patients. And once they have gone into a very advanced arthritis, obviously replacement becomes inevitable. But if there is a localized area of a damage, especially a chondral area or a weight-bearing area where the cartilage is damaged, even today what we can do is from the non-weight-bearing area of the joint, we take the cartilage, we send it for culture, we grow the cells, and then they are injected back into the joint with the help of a membrane, and there is a preservation of the joint which can be done where we can actually prevent replacement or at least postpone the replacement by few years for the patients who are younger and who are suffering from the arthritis.